Hi, my name is Sarah Gasco, and this is Samantha Griffith, and I'm going to be performing a lower body assessment on Samantha. Anytime you perform any type of assessment, you always want to get their vital signs. So you use a blood pressure cuff, a stethoscope, and a watch, of course, and then a thermometer. But I'm not going to explain how to do that because I've done that in previous videos. So the first assessment we start with, when we start with the lower body, we could just go ahead and start with the muscular system. When doing the muscular system, you use techniques of inspection and palpation, and it's best to start with muscles and joints of the head first, followed by the upper extremity joints, lower extremity joints, and lastly the spinal column. But since this is a lower body assessment video, I'm going to focus on the lower body. We want to inspect and palpate the hips. You want to have the client lie in a supine position and inspect the position of the hip and the leg. The legs should be slightly apart, toes pointed upward with legs in equal length. You want to palpate the hip joint and upper thigh. Normally the joint should be firm, stable, and non-tender. Now you want to assess for range of motion of the hip. With the client laying in the supine position, have the client raise the leg off the table, flexing the hip and keeping the leg straight, which is called flexion of the hip. Then you want to have the client raise the leg with the knee in a bent position towards the chest, which is flexing the hip. Have the client bend the knee, keeping the foot on the table. Have the client move the knee toward the medial, which is internal rotation of the hip. Then have the client move the knee away from the body, which is external rotation of the hip. With the legs flat on the table, move one leg away from the midline, which is considered abduction, then move the leg toward the midline, adduction. Have the client lie on the abdomen in prone position. Raise one leg off the table, keeping the knee straight, hyperextension of the hip. Test for muscle strength of the hips. With the client lying in supine position, provide resistance by placing your hand on the thigh while the client raises the leg without bending the knee. Place your hand on the lateral side of the knee and have the client abduct the knee to the lateral side while you provide the resistance. Place your hand on the medial side of the knee and have the client adduct the leg while you provide resistance. Then you want to repeat on the opposite side. Considering it would be hard using a laptop and having Samantha lie down and show it, I just described it. Some of the stuff she'll be able to do, but some stuff I think it's going to be hard to provide on a laptop. The next place we're going to move to is inspection and palpation of the knee. Inspect the knees with the client in the sitting position, letting the knees hang freely off the table. Normally the knee should be symmetrical and free of lesions. You want to inspect the quadriceps muscle of the anterior thigh. The muscles should be symmetric. You want to palpate the knee with your thumb placed on one side of the knee and your first and second digit on the other side of the knee. Start palpating above the patella and palpate downward gently over the entire knee. Normally the muscles are firm and there is no tenderness noted. Palpate the tibiofemoral joint by palpating the lateral side of the knee. Normally the joint is firm and non-tender. Now you want to test for bulge sign. With the client in the supine position, assess for fluid in the suprapatellar bursa. With your first and second finger, stroke upward along the medial aspect of the knee several times. Apply pressure to the lateral side of the knee and observe the medial side for presence of fullness caused by fluid. Now you want to assess for range of motion of the knee. With the client in the supine position, have the client bend the knee and raise it toward the chest and return it to the original position. Test muscle strength by having the client bend the knee and raise it toward the chest while you provide resistance above the knee. Now you want to inspect the knee while the client is standing. Maintain client stability by having the client hold on to a chair if necessary. Normally the knee should be in alignment with the thighs and ankles. You want to observe the client walking. Normally the client should have a steady gait. The next part we're going to move on to is inspect and palpate the ankles and feet. Inspect the feet and ankles in walking, standing, and sitting positions. Normally the skin will be uniform in color with each position. There should be no apparent evidence of swelling or skin breakdown. Palpate the ankles with your thumbs on the anterior and lateral surfaces while holding the heel of the foot with your hands. Normally the joints are firm and non-tender. Palpate the posterior ankle, the Achilles tendon. Normally the area is free of pain, tenderness, and nodules. Palpate the metatarsal phalangeal joints. Joints should be firm and non-tender. Now you want to check for the range of motion of the ankles and the feet. The client should perform the following movements: dorsiflexion of the foot by bringing the toes up towards the ceiling, and then plantar flexion by pointing the toes down, which is just like that. Then position the sole of the foot outward and then inward, which is kind of just like moving your hand out, but it's your foot. And then flex the toes by curling them downward. Abduct the toes by spreading them out in a fan pattern and then bringing them in together. That's abduction and adduction. Then you want to test the muscle strength of the ankle by dorsiflexion and plantar flexion against your resistance. Test the muscle strength of the foot by flexion and extension of the toes against resistance. Palpate each interphalangeal joint. Normally there is no pain or tenderness and the temperature is the same as the rest of the body. Now we move on to the spine, which also consists of techniques of inspection and palpation. With the client standing, inspect the spine. Normally the cervical and lumbar curvature is concave and the thorax curvature is convex, which Samantha's back seems to be okay. Then you want to observe the length of the spine for lateral curvature. Observe the level of the right and left scapula. They should be on the same plane. Observe the right and left iliac crest. They also should be on the same plane. Palpate each vertebral process. Normally they are in alignment and are non-tender. Palpate the muscles on both sides of the neck and back. So you just kind of feel for anything that seems abnormal. Now we want to check for the range of motion. With the client standing, have the client perform these movements. Have the client touch the chin to the chest. And then have the client look up to the ceiling. Hyperextension. Next, the client should be able to bend the head side to side by touching the ear to the shoulder without moving the shoulder. Do you have any problems, Samantha?
No.
That's called lateral flexion. Finally, have the client turn the head from side to side as far as possible, then to the other. That's called rotation. Any pain?
Mm-mm.
Now we want to check for range of motion of the thoracic and lumbar spine. Standing behind the client, place your hands on the client's pelvis and stabilize the client while the client bends to each side. That's called lateral flexion. Have the client bend forward and touch the toes, which is flexion, and then bend backward to a comfortable position, hyperflexion. Have the client twist at the waist by rotating the shoulders. Next, we move on to the assessment of the abdomen. When assessing the abdomen, it is important to mentally divide the abdomen into 4 quadrants. You want to divide them into the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. When performing an assessment on the abdomen, you will use all the assessment techniques in the following order: inspection, auscultation, percussion, and palpation. It is important to auscultate prior to percussing. In this case, because the abdomen is palpated before it is auscultated, it creates a false perception of bowel sound activity due to alterations in intestinal peristalsis. Inspection of the abdomen. Instruct the client to lie in a supine position with a pillow under the head for comfort. Observe the profile of the abdomen for contour. Normally the abdomen should be flat, rounded, or have scaphoid contours. Inspect the umbilicus for position, cleanliness, inflammation, and drainage. Inspect skin for color, moisture, lesions, or abnormal markings. And inspect for symmetry and abdominal movement such as pulsations. Samantha's stomach seems to be normal as everybody else's. Now you want to auscultate the abdomen. And you would use that with your stethoscope. With the client lying in the supine position, instruct the client to breathe normally. You will be listening for abdominal sounds with the client in this position. Using the diaphragm of the stethoscope, and begin listening to bowel sounds in the right lower quadrant, and then the right upper quadrant, and the left upper quadrant, and finally the left lower quadrant. You're making a square. Note the characteristics and the frequency of the sounds heard. Listen for 1 minute or until bowel sounds are heard. Listen for a full 5 minutes in each quadrant if no bowel sounds are heard initially. Normal bowel sounds are heard approximately 5 to 30 times per minute. Bowel sounds are normally gurgling at irregular intervals and high-pitched in sound. Auscultate the abdominal vascular sounds by using the bell of the stethoscope. Listen to the renal, iliac, and femoral arteries comparing side to side. Listen over the liver and spleen for friction rubs. Friction rubs are not normally heard. I'll go ahead and listen to her abdomen. Start. I didn't listen for the full minute because I just wanted to show you where you would place the stethoscope, but she does have normal bowel sounds. Now you want to palpate the abdomen. Palpation of the abdomen is an assessment techniques used to determine the size, the organ size, and possible evidence of a mass or presence of fluid. With the client in the supine position, lightly palpate with the pads of your extended fingers in each quadrant, beginning in the right lower quadrant and moving to the right upper, and left lower. Observe for facial expressions or grimacing and note any guarding behaviors, as these can be an indication of the client experiencing discomfort. Normally the abdomen is soft and non-tender with no evidence of pain. Palpate again, and this time using deep palpation by placing your dominant hand with fingers extended on the abdomen with your non-dominant hand placed over it. Identify the structures lying under your hands. Palpate in the same sequence as before. Normally there is no evidence of mass or tenderness. Are you having any pain?
No.
No. And everything feels okay. Percussion of the liver and percussion of the abdomen can also be performed, but as a general nurse, we do not percuss. Only specialized nurses do. Next, we move on to the assessment of the female reproductive system. Assessment of this includes the urinary and reproductive systems of a female. Inspection is also performed. And I'm not going to ask Samantha if she can take off her pants and show the whole wide world. So I'm just going to explain how to do this. First, we start with the assessment of the urinary system. When you perform this, you're using assessment on the urinary system. You use techniques of inspection, palpation, percussion, and auscultation. Then you would move on to the reproductive system. When performing an assessment on the reproductive system, you use techniques of inspection and palpation. First, the urinary system. Inspect the left and right costal vertebral angle for protrusion indicating an enlarged kidney. Inspect the flanks for symmetry and color. Palpate over the left costovertebral angle. Normally, no discomfort is felt. Then you want to palpate the lower pole of the left kidney. It's usually not palpable, but attempt to palpate with the client in the supine position. While standing on the client's right side, reach over the client and place your left hand under the client at the level between the end of the ribs and the iliac crest. Place the right hand on the left upper quadrant of the abdomen. Instruct the client to take a deep breath, and as the client inhales, move your hand deeply into the client's abdomen to capture the left kidney. Have the client hold their breath and then exhale slowly. As the client exhales, you may feel the kidney move into its original position. Then you want to palpate the lower pole of the right kidney, and you would just use the exact same steps as before, but on the opposite side. Now we move on to the physical assessment of the urinary bladder. Palpate the urinary bladder by using light palpation over the lower portion of the abdomen. Assess for symmetry, location, size, and sensation. Use deep palpation to palpate the fundus or the base of the bladder. Normally the bladder will feel smooth. An empty bladder is usually not palpable. A full bladder is usually firm. Now we move on to the inspection of the reproductive system. Position the client in the lithotomy position on the examination table. Inspect the pubic hair. Normally hair grows at an inverted triangle pattern on the female. Inspect the labia majora. Normally fuller and rounder in the center of the structure. Inspect the labia minora, which is normally smooth, pink, and moist. Now you want to inspect the clitoris. Place your right and left hand over the labia majora and separate structures with your thumb and index finger. Normally skin is smooth, pink, and the same color as surrounding tissue. Inspect the urethral orifice. Normally pink, smooth, and split-like in appearance. Inspect the vaginal opening, perineum, and anal area. Normally the vaginal opening is pink and round. Perineum is smooth and firm. The anal area is moist and darkly pigmented. Now we palpate the reproductive system. Palpation of the vaginal walls begins with the client in the supine position. Insert the fingers into the right wall of the vaginal opening and rotate around in a counterclockwise motion, feeling for texture. Instruct the client to bear down or cough, noticing any bulging existing in this area. Palpate the urethra and Skene's gland. With your right index finger still inserted into the vagina, place gentle pressure upward against the vaginal wall. This technique puts pressure on both the urethra and Skene's gland. Palpate the Bartholin's gland by gently squeezing the posterior region of the labia majora between your right index finger and right thumb. Palpate bilaterally for assessment of both Bartholin's gland. That's that. And then we move on to the mental status, which could be considered, which is normally done at like the very first by just talking to a patient. You can tell if they have any mental issues or not. But first we assess the mental status first. Look at the client's appearance. Is the client dressed appropriately for the surroundings, the season, his or her gender, and age? First, we want to assess the speech and language, which is just by talking with your client and ask questions so you can assess speech, pronunciation of words, volume, and ability to respond to questions. Then we want to measure and assess client sensorium, or perception, by asking the client to state the date, time, and place and name. Then we want to assess their memory by just asking them their birthday, the ages of their children or grandchildren, and dates of special events. And then you want to assess for abstract thinking. Ask the client to tell you how two things are similar and different. An example would be apples and oranges. Both are similar in the fact that they are fruit and round. Then you want to assess the mood and emotional state. Observe facial expressions and tone of voice during the assessment. Perception of thought processes. The client's communication should be logical and relevant to the conversation. Then you want to ask the client to talk about the client's job and any future plans. Ask about the client's health, family, and any celebrating events coming up. This just kind of gives you an overall general feeling if the client is confused or really confused, or if they seem normal. Then you want to assess cranial nerves. And the first cranial nerve is the olfactory, which is smell. And you just put things under their nose that they would think that they would be able to tell the smell. Then you want to assess their optic, which is their vision. And you can use a magazine or a newspaper with near vision. Then you want to assess the cranial nerve 3, which is testing the 6 cardinal points of gaze. Then you want to assess the trigeminal, which is when the person's eyes are closed, test the sensory function by touching the face with a wisp of cotton in several areas, and have the client voice now when the client feels it in each area. And then you want to test their facial muscles by having the client perform the following: smile, show their teeth, close both eyes, puff out the cheeks, frown, raise the eyebrows, and note the symmetry of each. And then you want to test their hearing by using the Weber test, and you can also use the Rene test also. And then you want to assess motor function, which is cranial nerve 9 and 10, by using a tongue blade to depress the tongue and tell the client to say ah. You should see the movement of the soft palate and the vulva. And then assess cranial nerve 12, assessment of the movement of the tongue. Have the client stick out the tongue and move it to left to right, and finally retract the tongue. I didn't assess cranial nerve 11 because that's already assessed in the spinal assessment. You also want to assess motor function. Make sure their walk is steady and their balance is stable. Also assess the ability to feel touch, whether it's light or deep, and what kind of sensation they feel. You also want to assess reflexes, making sure they are normal bilaterally. At the end of the lower body assessment, document everything abnormal. Abnormal signs show us problems with our clients. It prevents us from performing unnecessary tests and wasting time and money. Therefore, document everything abnormal. It helps us get to the sign of the problem a lot closer. Thank you.